I think it's the patient's perception of what sinus surgery is and what it actually is quite different, because there's still a perception that it's the worst thing ever and it's incredibly painful, and it's not. Even done under general anesthesia in the operating room, most of our patients, if we ask them what is your pain level on a 0 to 10 scale, 0 no pain, 10 worst imaginable, we get a lot of 3s, 4s, and 5s back. And so when I tell patients that, they all go, oh, like, that's not so bad. I would, like they would have thought 7, 8, 9, maybe 10, worst imaginable. And so it's clearly not as painful as it used to be. I think doing endoscopic septoplasty has definitely helped. And not everyone does endoscopic septoplasty. It's been a trend, I think, in training. I think residents are being trained to do endoscopic septoplasties. And it's just a smaller incision. It's a little further back. The nasal tip is not as sore. And there's less swelling as a consequence. I think there's also a move away from putting splints in the nose or any kind of packing that has to be removed, and that's significantly better, because that's one of the patient's fears is, you're going to pack my nose and then you're going to have to unpack it. And when we say we don't use packing that has to be removed, if we put anything in your nose, it's dissolvable. They're like, oh. And you can just see that deflates one of their big balloons as an objective to why they don't want to have sinus surgery. I'm not going to go through it because of that. And then you tell them that you don't do that, and then they have to kind of let the air out, and they're like, okay, well, maybe I'll be willing to consider this. Where previously it was just off the table. You're going to have to treat with medicine because I am not having surgery. I think it's enough different in terms of the techniques and some of the materials we use to help reduce bleeding afterwards, but it's also just an understanding and a change of perspective in terms of what they expect it to be.